All right, so we are now here for the acupuncture for urticaria. So for the wind heat in the skin, um, which has an acute onset, red wheals with distinct margins, intense generalized itching, and itchy areas changes from day to day. It has red tongue, floating, and rapid pulse. Now for the wind cold in the skin, it has an acute onset, pale red wheals, itching, and the pulse would be floating. Now, for the heat fire, it is with large red wheals that could be cord shaped rather than round, mm. swelling, and discoloration of the skin on scratching. Now, it gets worse at night. The patient could have mental restlessness, insomnia, and the tongue would have a redder tip and dry yellow coating, and the pulse would be overflowing and rapid. For the liver blood deficiency with internal wind, the urticaria would be chronic, and it comes and goes with pale red wheals, and that is aggravated by overexertion. Oh, okay. Slight itching, dry skin, dry hair, pale and dry tongue. Now it's possibly fine and choppy. Now for the toxic heat in the sun, it would be the wheels would be bright red or dark red that may join to form large patches with acute onset, severe itching, feeling of heat, mental restlessness. Now the patient would have red tongue with red points and thick, sticky yellow coating. The pulse would be overflowing, slippery, and rapid. Now for wind heat in the skin with stomach and spleen chi deficiency, this is chronic urticaria, and it okay. So for the wind heat in the skin with stomach and spleen chi deficiency, the urticaria is chronic now with in this case, and it would be accompanied with pale red wheals with indistinct margins, which is aggravated by overexertion. It would have slight itching, um, aggravated also by eating certain foods. The patient would have loose stools, tired, and poor appetite. The tongue would be pale with an empty pulse. Now, this harmony of penetrating and directing vessel, urticaria in this case, is worse before the periods and better after, and worse in the lower part of the body and legs, and there would be slight itching. For blood stains in the skin, it would have large, dark red or purple wheals, itching, purple tongue, wiry or dropped balls, which is obvious why it's called. Now we have stomach heat. Urticaria here will have red wheals with distinct margins, and that is elicited by eating certain foods, um, accompanied by itching, burning, epigastric pain, thirst, sour regurgitation, nausea, excessive hunger, foul breath, feeling of heat, and the tongue will be red with a yellow coating and an overflowing rapid pulse. For blood heat, it would have wheals that are very large and bright red. Of course, itching is there. An intense feeling of heat. Skin would be very hot to touch. And the patient would have mental restlessness, insomnia first, and the tongue will be red with an overflowing rapid pulse. Now, for the interesting part, the body acupuncture and the ear acupuncture points that we can use. So for the wind heat urticaria, we have do 14, LI 11, spleen 10, bladder 12. For wind cold, we have bladder 12, bladder 13, gallbladder 31, LI 11, and spleen 10. For dampness heat, we use LI 11, LI 4, Zusan Lee or stomach 36, spleen 10, and Sanyin Jiao or spleen 6. Now, for deficiency of qi and blood, we use Zusan Lee, stomach 36, spleen 10, Sanyin Jiao, spleen 6, bladder 17, bladder 20, Brent 6, and Pigment, the bladder 12. Now, for the ear acupuncture, we use the Shenmen, the lung, the occiput, and the adrenal point. All right. Hope you took a screenshot of that or take note of it. Thank you.